Good evening, everyone, and welcome here, and thank you for your opening statements. I suppose to start with Pobal, I want to first of all acknowledge the AIM programme, because I think it does vital work, supports so many young children with additional needs, in preschool and in play school and before they go to school. And it's a model that maybe could be continued into primary and secondary level, instead of relying on a diagnosis for supports. It's something that should be looked at. So I want to just acknowledge that. I suppose my first question would be, and the same question will go to the Enterprise Ireland as well. How do you consult with DPOs and disabled people on any of the programmes that you deliver? Because I think it's really important that disabled people have an input from the start, and that programmes aren't designed to meet the needs that we think they will. That we talk to disabled people and recognise that in the UNCRPD they have a right to be part of engagement and consultation from the start, or the representative organisations, and just how you do that. You have referenced workability. I just wonder, would you expand a little bit more on that, because it sounds like it's going to be very good. I suppose accessibility is really important, and a lot of time when we think of accessibility we think of the physical building, but it's not always about a physical building. So it's even about online resources, and you have mentioned different online courses and so forth that you deliver. It's just that the EU Web Accessibility Directive Pobal scored accessibility score of 17.33, so it's just how to improve on that and ensure that websites are accessible. For many people with a disability may rely on that. They may have an intellectual disability, so they may need easy read. It may be that they have a visual impairment, or it may be that they're, there's different disabilities, and that they're all accommodated on that. In relation to Enterprise Ireland or the LEOs, I suppose again how you engage with DPOs, that same question there, and in the different programmes that you deliver. I do again want to welcome what you said there. You're working to deliver a new online course in conjunction with TUD, and I think that's really important and really good, because we would have heard from different disabled people here who say that there are many supports for employers to employ a disabled person, but the same supports don't exist to employ themselves, in other words, and that their needs are often very different, so they may be to do with chronic pain, or maybe not able to work full days, that they need different tailored supports to ensure that they can start their own business. So I think that online course will be very good, and I welcome it. So I'm just wondering, if that's oversubscribed, will you, it's for 20 people, do you envisage that's enough? I suppose it's maybe a recognition that to date you weren't meeting the requirements of disabled people, so it's good to do that as well. And there's just one other thing, just going back, sorry, to Pobal there. I know you mentioned there around the Pobal HP deprivation index, and that disability rates that you're twice as likely to have a disability. But if you turn that the other way around, is that people with a disability are twice as likely to be poor, or maybe because the employment rates, as you said, are shocking, and we know that in this country. Employment rates for disabled, we're the worst in Europe. And we know there's a significant cost to disability. And so a lot of disabled people are poor, they are struggling. So it's because of their disability and the lack of supports that they end up living in poverty, So it's not that you're more likely because you're poor to have disability, it's the other way around, that you're more likely, you know what I mean, like it's just the other way around as well. So just thank you for that.
Look, and thank you, Deputy. I'll maybe start, and we'll hand over in due course to some of my colleagues who are more subject matter experts in some of the areas. In terms of the consultation, we published a guide to inclusive community engagement in local planning and decision making in 2022. It was launched by Minister Joe O'Brien. It was developed in partnership with the Department of Rural and Community Development, the local local development companies, and Pobal and stakeholders. So individuals with disabilities, individuals from marginalised communities, and we use that very much as a guide and as a template in terms of how we consult with disability provider organisations or other marginalised groups for whom community development is an area of interest and with whom we would be working. So guide number 1 was published. It was updated on the basis of our experience of implementing it, and late last year was relaunched or certainly raised at the National Civic Forum by Minister Paschal Donoghue in terms of the way that communities should be consulted with. And I don't know whether Paul might be in a position to add additional information into it. We've done some pilot projects in it, but we certainly apply the principles of the consultative process as set out in the document. There's always learning, Deputy, in relation to that, you know, it can be used to identify, for example, who should be involved in a community consultation, how you might go about supporting them, working with them, making sure they're meaningfully involved, meaningfully communicated with, and meaningfully supported should they need that as part of that communication process. So that's certainly all very well documented and set out in an accessible document with case studies and exemplars, so that local community organisations, not just Pobal or other state agencies, can actually use it as a resource. So I don't know, Paul, do you want to add to that?
No, yeah. And the only thing to add is, and when I talk about workability, I can explain in terms of the consultation process, but absolutely in the programmes that we deliver, and in the processes, for example, in application processes for the organisations that we support, it is part of that process that they have to engage with the people that they're going to support. That's a requirement in the application process. So it is very much part of the translation of the policy that is there into the programme development, that the application process to any of the programmes, and I can talk about the workability programme, that it has to be based on the need of those with a disability.
Do you want to go ahead with
Well, I can talk about a really interesting programme that is a follow-on to an earlier programme called the Ability Programme. But the Workability Programme it's co-financed by ESF and is led by the Department of Social Protection. It has got a budget of over 30 million, and it opened last year in 2023 for applications, and projects that have applied are going to run from the beginning of this year to the end of 2028. And it is really interesting, as a result of the Ability Programme, which was a programme again to support people with disabilities into employment, into training, that the evaluation of that programme identified that there's other things that need to be done for any follow-on programme. So in this particular programme, the aim of it is to ensure that people with disabilities are fully supported to find and maintain employment, and the organisations who employ participants, programme participants, are supported to ensure that their employment is successful. So over 50 organisations applied. 50 organisations have now been supported. That's a mix of local, regional and national projects that focus in particular to bring people with disabilities aged 16 years and older who are currently not work ready and or are distant from the labour market closer to the labour market. So it has really just begun as a programme, has got fairly clear objectives around supporting to improve the employability and increase the employment rates that we know are low and career progression of participants. There's a real effort to engage more with employers to encourage and support them to develop more accessible and inclusive workplaces. And then also the effort to try and pilot new initiatives and innovative initiatives to support people with disabilities into employment. So it really just has begun as an initiative. There is a 5-year, which is really important. That was one of the lessons from the previous programme. People need, and organisations need, time in order to be able to support those with a disability into employment. It's got quite an ambitious target, over 13,000 participants within the programme. But as I say, we've just started. We recently had 2 events. One event in Limerick and one event in Dublin with the organisations, and got really interesting feedback in terms of both what they are seeking as support from us, what they are seeking to do between themselves to kind of network, and also the kind of supports that they'll seek to provide to people with disabilities. So really at the start, but a really interesting programme. Countrywide, yes. Countrywide.
So everywhere,
yeah, and I can send you on the list of organisations that have been successful. Yeah, so yeah, and it's countrywide, and there are national, local, and regional. It's a good mix.
Deputy Tully, I absolutely acknowledge the poor findings on the accessibility of our website. What we have done is we have re-procured for a website redesign, and that's literally about to go live now. I think a lot of the issue is we carried a lot of PDF documentation on there, which is a challenge for individuals, particularly maybe with the visual impairment, etc. So we're actively working on that in 2024 as a project to improve it. Fully accept the findings from the NDA and are currently implementing the required areas for improvement. As you've expressed an interest in AIM, I might ask my colleague Delia maybe to let you know a little bit more about, what the plans are for 2024 into 2025 for the further development of AIM.
Yeah, so thank you very much, Deputy, for the acknowledgement of the programme. I think the AIM programme has been very successful. We've seen that from the 3-year evaluation. The fact that it is a needs-led model as well, as opposed to a diagnosis-led, has been really positive in terms of the inclusion of children, particularly the inclusion of children with disabilities into the ECC programme, into mainstream preschool, so allowing them to be part of mainstream preschool. Just to give you some of the figures as well, since its inception in 2016, we've supported over 30,000 children who've been in receipt of AIM support in over 4,000 early learning and care settings. And currently this year, we are actually supporting over 8,000 children in over 2,700 ECCE settings, which is really positive. We have a team of early years specialists that work directly with the services in terms of building the capacity of educators through a mentoring and coaching element, through educational advice and support in terms of how they can support a child's inclusion and accessibility and access into the preschool setting. And so I suppose the model and the positive outcomes and I suppose what the findings of the evaluation did identify was the need for the expansion of the programme. It also laid that out within the first 5 whole of government strategy around expanding and upscaling AIM. So this year that will be happening in September 2024. So the hours will be increasing into full day care for those children who are in receipt of ECCE. That's in term and out of term as well. So allowing for that more accessibility, but also as well what that allows for is for, I suppose, comfort in terms of families being able to engage in work as well. And also I think as well what it did identify in the evaluation, and which will continue in terms of being allowed to enabling children to access full day care with AIM support, is that relief of stress as well and that respite as well that the family can get through that support. So so I'm happy to answer any further questions, but that's just kind of, I suppose, a summary in terms of what's happening. And as well as that, I suppose the evaluation also recognised in terms of the application process for AIM, but also, I suppose, the second year extension process for those continuing on and ensuring that they have support and that comfort of support in their second year of ECCE without having to reapply. So that process will actually be changing this year to make it, I suppose, more simplified for providers to be able to apply directly. And we know that those children will be returning to ECCE and will require that support. So therefore, giving them that comfort of having that support in September for the child.
And just to follow on from Pauline Tully's question or opening remark on it, has there been any discussion on the AIM programme to carrying it into, or look at the feasibility of having that extended into primary school and post-primary school, because of the simplicity of it, and the complexity at the other side to try and have it carried on? Has there any engagement or any discussion?
I'm not aware of any engagement in relation to that, but I would think it is a model that could be, I suppose, transferred into preschool or considered, or into primary school, but I'm not aware of any conversations in terms of the department.
And even I've spoken to some early, early children's educators, and they're saying that they don't even have an input into the child starting primary school. Like, they have amass so much information about a child and supports that child needs and what works and what doesn't work, and yet there's no mechanism for transferring that information from the early childcare sector into primary school. There is for what there used to be through the CDNTs for primary school into post-primary, which makes sense, but I mean there needs to be joined up thinking, I think, between the different sectors. And it's not happening at the moment.
Yeah, and in terms of transitions, a lot of work has been done in relation to transitions from preschool to primary schools, and we try to do a lot of that work and support educators in that. And so we have some documents around My Inclusion Plan that can be shared as well with primary schools, but also there is the NCCA Mashcale that can support that transition as well. And then there was Let's Get Ready as well that was developed during COVID in terms of supporting that transition from preschool to primary school as well. So we do know that there needs to be more work done on it, and also within the draft autism strategy that has been written in there in terms of supports for early learning and care educators to support that transition of children into
possibly it's down to the primary school itself and whether it's open to accessing that information. Okay, thank you. Thank you.
Just your final question related to the deprivation index, Deputy. I'd like to say it's as simple as that. I suppose what the data is showing us is that there's a correlation, a really strong correlation you would have seen from the briefing document, like a straight line graph. So people who live in, individuals with a disability, 14% live in affluent areas and 30% within a disadvantaged area. So do they live there because of their disability, or is their disability a causal factor of their environment and the area where they're educated and the opportunities? So I do think the causal factors could be investigated further, but it's certainly a very strong correlation and very stark. As you said yourself, is it because their lived reality is socioeconomic disadvantage, poverty, poor living environment, which are all the factors that we collect within the deprivation index, or are there other factors there at play?
A lot of people are forced to depend on social protection payments because they can't work, because there aren't the proper supports there to get them into work. And so, you can look at it both ways,
There's certainly a very strong correlation, but the causal factors is probably, I spoke to a colleague earlier today, the topic of a very interesting PhD or piece of research, I would imagine. Yeah, absolutely. So thank you, Deputy. Thank you, Carlick.
Donald, do you want to comment on our Vice Chair's questions?
Indeed, thank you, Chair, and thank you, Deputy, for the question. I suppose Enterprise Ireland is just address a couple of specific points. Enterprises is lucky. We revamped our website at the end of last year, so it meets the compatibility requirements. So whether we would have had the same answer for you or not a year ago is another question. So timing was good there. Addressing your point about how do we consult with disabled people and how do we consult with DPOs, there are a number of routes for that. As well as following the rules, we our partnership with Open Doors gives us a huge amount of information and advice to see what we don't see, and that helps us. And part of that is Employers for Change and the advice they gave us. Another aspect of it is the fact that we're gathering the data. We've gathered the data using the organisation Inclusio. At the end of 2023, we carried out a very extensive equality, diversity and inclusion survey. That was run last year. At the moment, we're cleaning up the data, so it hasn't actually been produced yet. And that won't actually solve any problems as such, but it'll give us a baseline of where we're at. And we're going to use that data, and so it'll be, as well as sort of the human side, we have metrics to see how well we're doing or not doing. And then another aspect of sort of getting advice and sort of being informed by the end users is that Enterprise Ireland is a member of it's a new working group. It's a stakeholder and client working group that will develop an approach for reasonable accommodations, and that initiative is being led by Public Appointment Service. But being part of that process means that we're informed by people with disabilities as well. And so what the intention of the project is to transform the approach to reasonable accommodations for candidates with disabilities. And the output of that should be, the plan is that there will be a pilot programme in 2024 from that working group. So that's how we get advice from stakeholders and true stakeholders. And just in terms of supports for entrepreneurs, absolutely. Even in the UN Convention, it does mention entrepreneurs, but only once or twice. But it is there. And what we are working on at the moment is a campaign for visibility of entrepreneurs with disabilities. And you know, a number of them of prominent, successful entrepreneurs who don't need too much encouragement, I would imagine, but that you'd be aware of them. And there are a number of them are clients of Enterprise Ireland and the LEOs, and we're going to be doing a campaign with a number of them so that people will see it and they know that they can carry forward themselves.
Deputy and Ciara, look, the programme you mentioned there, the Entrepreneurs for Persons with Disabilities, that programme was developed by Professor Tom Cooney in conjunction with several other organisations. And in fact, I attended some of the workshops. There was a number of workshops that involved a lot of organisations to develop that programme. So the LEO does support that programme, and we're partnering on it. We supply the mentors to the programme. And we also do some one-to-one activity with individuals on the programme. There is a Dragon's Den at the end of that, and one of our colleagues goes to that. There's a presentation of the LEO supports directly to those participants. In terms of the access and workability, the offices tend to take queries or applications from all participants. I think the number of people with disability is recorded around 1 million, which is about 1 in 5 of the population. So, you know, we're constantly getting people applying for to attend courses that we're running, which are online, and a lot of them are online these days. But there's always people ringing the office. If they make us aware of a disability, we will go about trying to provide whatever is required to have that engagement. We have a panel of mentors. If it doesn't seem likely, they could attend one of the courses, which we would be directing them to in the initial stage. We do have a panel of mentors that we can assign, and that one-to-one activity can take place. And again, if there are special requirements, we can access those requirements. So that's the way we do access. In terms of the website, the website is being redesigned at the moment. We expect it to be best practice, but it is going to take a bit of time before that is in place. It's currently being redeveloped. It's currently not being redeveloped. It's been designed. So we hope to have that in place in the coming year or two, probably two years, I'd say, with it before that one is ready. But we will be addressing some of the issues. We are having an audit done on the current site, and we will be trying to address, because I think the site is not totally fixable, if you know. So those are the issues there. And in relation to the course, it does get it does get oversubscribed, but I think there's a screening process on it to see who's best suited to attending that course. And again, there are those other engagements that the LEO offices have throughout the country to provide services.